Hi, I'm Dr. Arshad Malik, and I'm a board-certified gastroenterologist in Plano, Texas. I'm creating this video today to help patients understand about colon cancer and the apprehensions that people have about it. I want everyone to know that with colon cancer screening and with catching colon cancer at an early stage, it is a totally curable disease and one can get rid of it. It is estimated that 50,000 people will die from colon cancer in the United States during 2015. The lifetime risk of developing colorectal cancer is about 1 in 20. The good news is that the deaths related to colon cancer have been decreasing over the last 20 years or so due to several factors. Precancerous polyps are being found by screening and removed before they can develop into cancers. Treatment for colon cancer has also improved over the last several years. The key to beating colon cancer is to get screened at the recommended age. The current guidelines from the American College of Gastroenterology recommend getting screened at age 50 and then getting rescreened every 10 years or so unless your doctor recommends otherwise. That recommendation will depend on whether polyps are found, and if so, how many and what type of polyps. Also, if there is a family history of colon polyps, then screening can start at an earlier age. Today we're at the Preston Crossing Endoscopy Center in Plano, Texas, where I'm going to be performing a colonoscopy on my colleague, Dr. Kenneth Brown. Hello, Dr. Brown. How was yesterday? How did you do with your prep?
You know, it was not nearly as bad as I thought it was going to be. I just followed the instructions and it worked just great.
Perfect, perfect. Any concerns? Are you worried about anything for today?
Just want to make sure that I'm not in any pain.
We do these procedures typically on our patients. Most of the time, not most, but all of the time, you will be asleep. So there is no pain, there is no discomfort involved. Dr. Brown is a brave, generous soul, and so he's agreed to do this without sedation, purely for the purposes of this video. It is so that he can talk you through the video, but it's going to be totally painless and safe procedure otherwise.
Yeah, Dr. Brown, let's get you ready.
All right, we'll see you in just a little bit.
Thank you.
So the colonoscopy is actually not just a diagnostic procedure, it can be both diagnostic and therapeutic. Okay, so we're going to go ahead and get started. Dr. Brown's awake for this. Patients will be sedated by this point, so they're not going to experience any discomfort, okay? And at this point, all we're doing is we're gently maneuvering the scope and working our way in towards the end of the colon. We can see the walls of the colon really, really well, which is what we want. We want to be able to get just a perfect look at the walls so that we can really be sure that we're looking at everything. We inflate the colon, but we also periodically deflate the colon to keep it as comfortable as possible for our patients so that they don't have any gas or bloating or discomfort after we're done.
So now, you're going to take your time, come back, and this is where we're really going to start looking for polyps.
All of that little blood vessels, that's normal, that's the way it should be.
So even without anesthesia being wide awake, it's really not that uncomfortable at all. And it really is not that big of a deal. This is a life-saving procedure.
About 1 in 4 people make polyps. If you find a polyp, then remove the polyp. You're actually preventing cancer from developing.
We always talk about colon cancer as being the second leading cause of cancer death. We essentially have a cure for the second leading cause of cancer death, which is doing exactly this, a colonoscopy.
We always tell our patients the most important part of doing this is getting a good prep. Dr. Brown, good job with your prep.
All right, appreciate it, buddy. Thank you so much.
You're welcome.
Oh, and Dr. Malik, I'm going to do your colonoscopy next week, okay?
You got it.
All right.
Take care. In order to save patients the time and the expense of an office visit, I offer the option to schedule an open colonoscopy. For qualified patients, this means that you can just call my office and schedule your colonoscopy at a time that is convenient for you. My hope is that this convenience will encourage more patients to get their colonoscopy at their recommended time.